Hello everyone, welcome to my channel हमारा अपना आयुर्वेदा. In the series of agadatantra and toxicology, today we will see about the asphyxia. What is the asphyxia? A condition of a deficient supply of oxygen to the body that arises from the abnormal breathing. The second definition from the Adelson. What he defined asphyxia as a state in living organism in which there is acute lack of oxygen available for the cell metabolism associated with the inability of body to eliminate the excess of carbon dioxide. Here two things are important. The first thing is the lack of oxygen available for the cell metabolism, and the second thing is inability of the body to eliminate the excess of carbon dioxide. Now let's see about the types and the classification of the asphyxia. There are 7 types. The first one is the mechanical asphyxia, second one is the traumatic asphyxia, environmental asphyxia, toxic asphyxia, pathological asphyxia, postural asphyxia, iatrogenic asphyxia. Let's see one by one each and every type of asphyxia. First, let's see about the mechanical asphyxia. In this type of asphyxia, flow of air into the body is interfered by the mechanical means. What are the causes? The closure of external respiratory orifices versus mouth and nose smothering, occlusion of oral cavity and the oropharynx, for example gagging, occlusion of airway by air pressure on the neck like hanging and the strangulations, the obstruction of air passage internally like choking. Now let's see about the second one, traumatic asphyxia. क्या है traumatic asphyxia? The asphyxia is caused by the pressure and the fixation of chest and abdomen. वो ए टाइप का एस्फिक्सिया है जिसमें तुम्हारे चेस्ट पे या एब्डोमेन पे कोई प्रेशर आ जाए और कोई ऊपर से दबाव दिया जाए और जिसके कारण एस्फिक्सिया हो उसे ट्रोमैटिक एस्फिक्सिया कहते हैं. व्हाट आर द कॉजेस फॉर ट्रोमैटिक एस्फिक्सिया? द फर्स्ट वन, स्टैम्पेड, भगदड़ मचना. सेकेंड वन, न्यूमोथोरैक्स ड्यू टू पेनिट्रेटिंग इंजुरी टू द चेस्ट. Third one, person crushed under the vehicle, and the fourth one, the person crushed by fall of wall or the collapse of house or the earthquake. Today there is one question. Tell me what is the pneumothorax in the comment section. Let's see how many of you can explain it. Second type is third type, एनवायरमेंटल एस्फिक्सिया. एनवायरमेंट में एयर की कमतरता के कारण जो एस्फिक्सिया हो उसे एनवायरमेंटल एस्फिक्सिया कहते हैं. लेट्स सी. नॉन अवेलेबिलिटी ऑफ द ऑक्सीजन इन एयर कॉजेस दैट एस्फिक्सिया. एज आई सेड, environmental causes are like high altitude, the person trapped in well or the granary. Third one, respiration in enclosed space. Let me know in comment section about the people who are having high RBCs. Are they from high altitude places or low altitude places? Next type of asphyxia is toxic asphyxia. This form of asphyxia results from the poisonous substances. पॉइजनस सब्सटेंसेस के इनटेक की वजह से जो एस्फिक्सिया होता है उसे टॉक्सिक एस्फिक्सिया कहते हैं. एग्जाम्पल, साइनाइड पॉइजनिंग, ओपियम पॉइजनिंग, कार्बन मोनोऑक्साइड पॉइजनिंग. In previous videos I have explained about the classification of poisoning. So guys, let's see what kind of poisons these are. Just go and see the video and let me know in comment section. नेक्स्ट टाइप है पैथोलॉजिकल एस्फिक्सिया. पैथोलॉजी की वजह से, कोई डिसीज़ की वजह से जो एस्फिक्सिया होता है उसे पैथोलॉजिकल एस्फिक्सिया कहते हैं. लेट्स सी. प्रेजेंस ऑफ डिसीज इन रेस्पिरेटरी पैसेज और इन लंग्स प्रिवेंट्स ऑक्सीजनेशन एंड कॉजेज द एस्फिक्सिया. The entry of oxygen to the lungs is prevented by the diseases of the upper respiratory tract or the lungs. For example, laryngeal edema, spasm, tumor, and the abscess. Next type is postural asphyxia. इनएप्रोप्रिएट बॉडी की पोस्चर होने की वजह से एस्फिक्सिया होना, उसे पोस्चरल एस्फिक्सिया कहते हैं. लेट्स सी. पोजिशनल एस्फिक्सिया इज ड्यू टू peculiar body position that prevents adequate gas exchange. This is seen where an unconscious or stuporous person, either from the alcohol, drugs, or the disease, lies with the upper half of the body lower than the remainder. And the next type of asphyxia is iatrogenic asphyxia. It is mainly associated with the anesthesia or even the side effects of drugs. Few drugs can lead to iatrogenic asphyxia. Thank you. For such videos, like, comment and share my channel and my videos. In next video, we will know more about the asphyxia and its type in detail according to NCERT syllabus. Do follow and subscribe my channel. Thank you.